Secondly, for the next largest group of Americans, those on Medicare, the program will be strengthened for them by doing such things as providing a medical home, a place where you can go so you don't have to self-diagnose and figure out what specialist you should go to. There will be a primary care center where you could go to get the diagnosis and the further referral. This is not a gatekeeper. This is not somebody who says you can't go to a specialist. But it is a medical home where you can go where somebody will treat you as a person, as a complete patient, rather than just as an object on whom procedures are done. It would close the donut hole for Medicare Part B prescription. As it is now, you know, if you spend more than a couple $1,000s, you end up then with no assistance from Medicare until you get into the kind of catastrophic high level of prescription medicine cost. This so-called donut hole, which I've always called cliff, goes along about July or August or September, when the patient, and there are thousands here in central New Jersey who fall into this, when they have exceeded that couple $1,000s, they don't get any assistance. And so you end up either cutting your pills in half and stretching them a little farther, or doing them out, or cutting back on your heating bill so you can pay for your prescription, whatever. That will be, that so-called donut hole, or what I call a cliff, will end. There are some other improvements to Medicare that will make it more efficient, but it will not. And let me anticipate one of the questions that will come up. It will not, to the best anybody can determine, cut benefits. In fact, it's explicitly said that it may not cut benefits. There certainly is savings to be found in some of the inefficiencies, some of the waste, and some of the abuse in Medicare. And we can go through the details of that. The idea is Medicare would stay as it is, but there would be some improvements made to Medicare, just as there have been improvements made over the life of Medicare. Since 1965, changes, every few years, changes are made to Medicare. It didn't used to cover mammograms or prostate screenings. Medicare does that. That's better care. Medicare didn't used to cover prescription medicine. It does now, in part, with this donut hole. This will now be a further change along that line, so that it will provide more comprehensive care for prescription medicine. So changes in Medicare are comparable to the kinds of changes that have been made every few years. Another change, and this is important, and this is an article of debate between the Senate and the House. And I expect the House will prevail in this, but I'm not sure yet. We have ended the forthcoming cut in reimbursement to doctors. As things stand today, if this law is not passed, over the next year and a half, doctors' fees will be cut by 50% for Medicare procedures and Medicare services. And a lot of doctors will take a walk. Right now, about 95% of all doctors participate in Medicare. This would be a problem, I think, if these cuts go through. By canceling the cuts, of course, that is seen by the government and by the Congressional Budget Office as a new expense. In other words, we will be paying doctors at this year's reimbursement rate rather than a 20% lower reimbursement rate. We have to do that, I think, for the care of the Medicare patients. But that is one of the things that is figured into the cost of this bill. Now, my guess is, even if there were not health care reform, we would cancel this cut. In fact, 9 out of the last 10 years in which these cuts were similar kinds of cuts, somewhat smaller, but the same idea, were to take place, they've been canceled year by year by congressional vote. What this bill would do is just end that whole automatic ramp down in doctor reimbursement. And I think we would do that independent of this health care. So, it doesn't mean that you don't count the cost. That is a cost to the Medicare program. But it is not a cost of, let's call it, Obamacare, as some people are labeling it.